Hello, Harry Brownlow, shoulder and elbow specialist. Today I'm going to talk to you about ruptures of the distal biceps tendon. So you all know your biceps muscle sits here in your arm. Now the distal bit is at the end down towards the elbow. This tendon, when it ruptures, typically occurs in men and usually in their 40s and 50s, and it's usually when you are bending your elbow up, but for whatever reason the elbow then suddenly gets stretched out. So a good example of when it might happen is if you're playing rugby and you're grabbing the jumper of someone as he's running past, but the elbow gets stretched out anyway, and that can cause a distal biceps tendon rupture. Now you will know something's happened. You will probably feel a pop or a rip or a tear or sudden pain, but you may not properly know what it is that's happened. And I'm afraid to say, when you go to casualty, you may very well see a junior doctor who's never seen this injury before. So if you think something's happened in your elbow and you're not satisfied with the response that you get from A&E, then do get yourself in front of a shoulder elbow specialist, and do so quickly, because treatment for this condition needs to be done early, that is within the first 2 or 3 weeks after injury for best results. Now, after a few days you'll start to notice some bruising, and very characteristically the bruising comes out here, just on the inside aspect of your elbow. And while you may find you still feel like you've got good strength in what most people consider to be the prime action of biceps, that is to flex your elbow, in fact there are lots of other muscles that flex your elbow which are unaffected, and therefore this will still be strong. But get someone to test whether you can hold your hand palm up against resistance. By that I mean, imagine you're holding your hand palm up, holding a cup of soup. Now, try and keep it palm up and get someone to try and twist your hand over, and you're going to resist them. We call this movement supination. Biceps is the only muscle that's a strong supinator. We're taught in medical school that the biceps muscle twists the corkscrew into the cork and then pulls the cork out of the bottle. So that twisting, forceful twisting, making your palm come up, is supination, and only biceps will do that. So even if you're a big guy with big strong muscles, if your distal biceps has ruptured, you will notice a distinct weakness in that movement. Now there are 2 ways you might choose to manage it if you know that you've got a distal biceps tendon rupture. You may choose just to accept the situation and live with it, and indeed that's a perfectly reasonable and acceptable way for very many people. Most people feel they don't particularly need to be strong at supinating, and the days of using screwdrivers are gone now that we all have electric tools to play with at the weekend. But for you it might be important that you have good strength of supination for whatever reason, or it might be important to you that the contour and shape of your biceps remains intact. And if that's you, then you need an operation. Now the key to the operation is it needs to be done quickly. Once the tendon has ruptured, the tendon tends to recoil like a giant elastic band, and the muscle tends to shrivel very quickly, which means if we're operating much beyond 6 weeks, it becomes sometimes an impossible job. So the quicker we can get to you, the better. And when we do an operation, it's done under general anaesthetic, that is, you're asleep, and can be done as day case, that means home on the same day. And we make a little cut in the forearm, and through that cut we can find the torn end of the tendon, we can pull it back down, and we can pin it back down into the bones using little metal anchors. It's quite a fiddly operation, and the operation, the way I do it, is incredibly close to one of the nerves that's responsible for the feeling down the side of the forearm, the outside of the forearm. So every one of my patients, I will warn you, there's a very strong likelihood you will wake up and for several weeks later have funny feelings down the outside of your forearm, right up into the base of the thumb. But in the vast majority of cases, these will settle down. Once you go home, you'll go home with half a plaster on you. Half a plaster around the back of your upper arm, round the corner of your elbow, and down the back of the forearm. And this will hold your elbow bent for 2 weeks. This is to allow the tendon to start to heal into the bone. I would then see you again in 2 weeks, and I'll take the plaster and all the bandaging off, and I will leave you to start to move your elbow at your own rate and very deliberately, without use of physiotherapy, for the first month out of plaster. I will see you again at a month after being out of plaster, so that is 6 weeks after your operation, by which stage I think you will have recovered full range of movement of your elbow. And at that point we can start with physiotherapy in an attempt to gradually build up the strength and resistance of your biceps such that by 3 months after the operation you should have returned back to normal. Now, as with all operations, there are potential risks and complications, and these need to be carefully considered before you sign yourself into having the operation, and therefore it's really important that you chat this through with your surgeon before considering an operation finally. Thank you very much.